plan the Prime Minister put forward today delivers on the commitment we made to Canadians to strengthen publicly funded universal health care in our country. All told, it will deliver $198.6 billion in additional federal funding for healthcare over the next 10 years. $196.1 billion of which is to provinces and territories. Our plan includes $48 billion in new funding that we are announcing today, which is comprised of 5 different funding streams. First, an immediate, unconditional Canada Health Transfer top-up of $2 billion to address the real urgent pressures in our emergency rooms, operating rooms, and pediatric hospitals. And this is in addition to the $6.5 billion in Canada Health Transfer top-ups that the federal government provided during the pandemic. Second, we will provide annual top-up payments to ensure provinces and territories who commit to improving health information see Canada Health Transfer increases of at least 5% per year for the next 5 years. At the end of those 5 years, the amount of the final top-up would become a permanent funding increase added to the CHT. Third, we will provide $25 billion over 10 years through a set of new bilateral agreements to ensure that every province and territory can address their unique health system needs. These investments will build on the $14 billion that we have previously committed to providing provinces and territories to improve mental health care, home and community care, and long-term care. Fourth, as we committed to do in the last election, we will provide $1.7 billion over the next 5 years to support wage increases for personal support workers. And fifth, we will provide $2 billion over 10 years to an Indigenous Health Equity Fund to be distributed on a distinctions basis with First Nations, Inuit, and Métis to address the unique challenges Indigenous peoples face when it comes to fair and equitable access to health services. It is our clear expectation that the funding we are announcing today will not be used in place of planned provincial or territorial health care spending. This funding from the federal government is additional, incremental money to improve the health care Canadians receive. That is what we expect it will be used to do, and that is what Canadians quite rightly expect as well. Il s'agit d'un investissement majeur dans les soins de santé financés par l'État. C'est un plan grâce auquel les Canadiens vont profiter d'un système de soins de santé universel de calibre mondial, financé par l'État. Un plan qui signifie que nous serons là pour les travailleurs de la santé qui sont là pour nous. Un plan qui signifie que peu importe notre revenu, le métier de nos parents ou l'endroit où vous êtes né au Canada, vous recevrez les soins dont vous avez besoin. We're investing in healthcare because it matters to Canadians. It matters to our children, and it matters to our parents. And for millions of Canadians, a universal, publicly funded healthcare system is central to what it means to be Canadian. We also know that a strong and effective healthcare system is an essential foundation of our country's economic success. The latest proof of that came just this week from the Ontario Chamber of Commerce, with 46% of the Chamber's members saying their business confidence was being shaken by concerns about the healthcare system. Getting this right matters to Canadians, and it matters to our economy as well. So this is a necessary investment. It is also a significant investment. It comes on top of the significant and necessary investments the federal government made to support Canadians and the Canadian economy during the pandemic. And it comes at a moment when Canada also faces a once-in-a-generation imperative to invest in the clean economy of the 21st century, to ensure that Canada seizes this opportunity rather than being left behind. These two great imperatives, to invest in healthcare and to invest in the clean economy, come at a time of great uncertainty in the global economy. They come at a time of real fiscal constraint. Canada can afford to make essential investments in times of crisis and in times of opportunity because of our AAA credit rating and because of our country's proud tradition of sound fiscal management. As we make difficult choices in the weeks and months to come, we will be mindful of that tradition and we will continue to be guided by it. Thank you very much. And now it is my very great pleasure to turn the floor over to my colleague, our Minister of Health, Jean-Yves Duclos.
Bonsoir tout le monde, good evening everyone. Comme le Premier ministre l'a mentionné, notre système de santé et nos travailleurs de la santé sont soumis à d'énormes pressions et les patients le sentent et le vivent à tous les jours. Cette situation nécessite des actions immédiates et collaboratives pour relever des défis actuels et à venir. Comme vient de le dire le Premier ministre, nous reconnaissons tous l'importance d'améliorer l'accès aux soins de médecine familiale, en particulier en milieu rural et éloigné, de soutenir nos travailleurs de la santé et de réduire les retards en chirurgie, y compris pour les enfants, d'améliorer l'accès aux services de santé mentale et de toxicomanie, et de moderniser notre système de soins de santé. On this fourth priority, let me clarify why we want to work together to modernize our health system. And that's because data saves lives. Better access to health information is essential for health workers to be able to provide safe and high-quality health care. Think about this for a few seconds. Imagine an emergency department, nurse or doctor, not being able to see what medication a patient takes, not being able to see or to access the results of previous tests a patient has undergone, or not being able to access the medical history of a patient. That's why we will invest in better data to support better health care and to support workers in the care they need to provide. In addition, helping Canadians age with dignity closer to home with access to home care or safe long-term care continues to be an area of common priority. Collaborative work is already underway with provinces and territories to help them support access to home care and long-term care through a joint investment of $6 billion over 5 years. Investing in these 5 areas of common priorities will help repair the damage caused by COVID-19 and prepare for the future. This being said, the province and territories each have their own unique circumstances. As such, they will have the flexibility to tailor their bilateral agreements to meet the unique needs of their populations and geography. Each bilateral agreement will need to reinforce common core principles. First, as per our shared responsibility under the Canada Health Act, governments must ensure that medically necessary services are provided based on need, not on the ability to pay. Governments must also ensure equitable access to health care services and that such access is supported by a strong public health care sector. Second, agreements will reflect our joint commitment to health equity and reconciliation with Indigenous peoples. We will work together to ensure Indigenous peoples across this country are able to access quality and culturally safe health services. Finally, we will also support better access for other underserved and equity-deserving groups, including Canadians living in rural and remote areas and those living in official language minority communities. Ces engagements sont importants pour prendre soin des Canadiens et de leur santé. Ces engagements nécessitent une collaboration solide entre les gouvernements. Et nous avons hâte de soutenir ces engagements encore davantage par les investissements majeurs annoncés aujourd'hui par le Premier ministre. Merci. Thank you. Miigwech.
On va maintenant prendre 20 minutes de questions. Monsieur le Premier ministre, on va prendre 20 minutes de questions. One question, one follow-up, and a list of questions.
So what was offered today was essentially repackages the new spending over 5 years that you had promised in the 2021 election, specifically on healthcare, but had not yet budgeted. Can you explain to Canadians why you believe that's enough, given that the crisis in healthcare has significantly worsened over the last year and a half?
$198 billion in additional funding for healthcare over the next 10 years. $48 billion of that brand new money that we know is going to be needed in healthcare in the coming years to make sure people have access to a primary care doctor, to support our healthcare workers, to make sure we're getting timely and proper mental health care, and to ground the system in a modern way in data and information to make sure patients get the best possible care and see that right across the country. But we know despite this historic investment, it's not just about money. It's about making sure we're delivering real results for Canadians. That's exactly what we're focused on doing. I'm really pleased we were able to sit down with the premiers today. And I look forward to the conversations we're going to have over the coming days and weeks to make sure that Canadians feel these improvements in a tangible way as soon as possible.
I'm asking specifically about new funding and in the period of 5 years, which was what tracked your election promise. Are you saying that this does go beyond your election promise from 2021?
We know that Canadians faced an extraordinarily difficult time during the pandemic. It demonstrated that our healthcare systems have gaps right across the country, even as extraordinary heroes stepped up in the front lines of our healthcare system to keep Canadians safe through such a difficult time. We saw that we need to do more to support them, to support the systems that keep Canadians safe. That's why this investment of $48 billion of new money for a total of $198 billion of additional funding over the next 10 years is something that's going to set our system for the better. We know there are immediate and short-term pressures on our healthcare systems, and that's where we're stepping up with immediate $2 billion worth of injection into our healthcare system. But we also know, we heard clearly from premiers, that a 5-year timeline simply isn't enough. They need to know that the federal government is going to be a solid partner for them as they hire more doctors and nurses, as they build new facilities, as they modernize their technologies. These are the kinds of things that provinces need to know. And that's why this announcement today that the federal government will be there in a big way to ensure better results for all Canadians over the coming years is so important.
Next question.
Jeannie String with CTV News. I want to focus in on your $48 billion of new funding. That's an announcement that will be made, it's over 10 years, which amounts to $4.8 billion of new funding each year. There seems to be a huge disconnect between that offer and what the premiers wanted, which was $28 billion new funding each year. Can you explain that disconnect and why you feel that your offer, what you are presenting today, is enough to sustain the health system?
Well, as you say, this is a significant injection of money into the healthcare system at a time where it's needed. We recognize that there is a need for money right now, and that's what the $2 billion that we're going to be sending to the provinces to help with pediatric care, emergency room challenges, backlogs and surgeries is going to make a real difference. But on top of that, that $48 billion of new money over the next 10 years on top of, or as part of the total of $198 billion in additional funds that we'll be sending to the provinces over the next 10 years, is a huge amount of money. But we know that it's not just about money needed to improve our healthcare systems. We need better outcomes. We need better support for our frontline workers. We need better infrastructure. We need better data. We need better access to mental health care. We need flexibility on delivering services, some online, some in person, that we've learned through the pandemic. There is a need to really make sure that Canadians are feeling and seeing the improvements in our healthcare system. So on top of the money, that's what we're focused on as well.
Given that there is a huge discrepancy between what is being offered today and what the premiers had initially wanted, is this your final offer? In an interview with CTV, Premier Blaine Higgs said that he was told this is take it or leave it.
We want to get to work negotiating flexible bilateral deals with the provinces that are going to deliver more family doctors, deliver better and faster mental health care, particularly for young people, deliver on more support for our frontline workers, deliver better health information and data that's going to ensure people get the best quality of care. This is significant amounts of money on the table. We know the premiers have said they need this money to be able to ensure a strong healthcare system going forward. I very much look forward to rolling up my sleeves and negotiating with them right away on delivering this money as quickly as possible to help healthcare systems across the country.
So we don't misquote you, it is your final offer?
Prochaine question.
Bonjour, Marie Chabot, Johnson Radio-Canada. La même question, en fait. Est-ce que c'est l'offre finale ou est-ce que vous avez encore de la marge de manœuvre pour en donner plus à des provinces qui pourraient avoir besoin de plus de financement?
La marge de manœuvre est dans les accords bilatéraux. On a regardé notre encadrement fiscal, on a regardé les besoins des provinces qui, actuellement, il y a plusieurs provinces qui sont en situation de surplus budgétaire, mais même à ça, on a fait une injection de 2 milliards de dollars de façon assez immédiate pour aider aux chirurgies qui ont été reportées, aux problèmes dans les hôpitaux pour les enfants, par exemple. Mais nous savons ce dont les premiers ministres avaient réellement besoin, c'est de l'assurance sur un plus long horizon. De savoir pour les 10 prochaines années, le gouvernement fédéral allait être là comme partenaire pour investir dans les choses qui sont vraiment importantes pour les Canadiens. Je sais qu'on a la mode, quand on parle d'investissement en santé, de toujours parler de combien d'argent on est en train d'investir. 1 milliard ici, 100 millions là. Mais ce qui importe pour les citoyens, pour les familles, pour les aînés, c'est si oui ou non ils vont avoir accès à un médecin de famille. Si oui ou non, ils vont pouvoir à l'urgence et être vus en dedans d'une heure. Si oui ou non, ils vont pouvoir avoir l'aide urgente pour leur santé mentale en situation de crise. Puis ça, c'est pas juste une question de dollars. C'est une question de travailler de façon intelligente, en partenaire, pour livrer ces services-là. Donc oui, nous sommes en train de faire une offre qui est l'offre qu'on a, qui rentre dans notre cadre fiscal, parce qu'on doit demeurer responsable, mais qui est assez pour pouvoir amener de vrais changements et de vraies améliorations dans nos systèmes de santé à travers le pays.
Donc, on comprend bien qu'il n'y aura pas plus d'argent pour les provinces. Il y a plusieurs premiers ministres qui ont dit qu'ils avaient gagné sur le côté des conditions, qu'il n'y en avait pas de conditions au final. Est-ce qu'ils ont raison? Et si oui, comment est-ce que vous assurez vraiment que les promesses que vous êtes en train de faire aux Canadiens, ils vont être livrées?
La proposition qu'on a mise devant les premiers ministres est ancrée dans les résultats concrets pour les Canadiens. Dans la transparence, dans la redevabilité directement aux Canadiens. On sait que les Canadiens ont besoin d'avoir plus accès à des médecins de famille. c'est quelque chose que les provinces savent très bien, c'est quelque chose que nous allons nous assurer de livrer en partenariat avec les provinces, avec ces ententes bilatérales. On sait que les gens ont besoin de meilleurs et de plus rapides soins en santé mentale. Ces ententes vont s'assurer qu'on est en train de les livrer. Tout ce qu'on est en train de faire est ancré dans des résultats concrets pour les Canadiens.
Prochaine question.
Hi, this is Angie Hilltimes Research. I want to ask about mental health funding. It's basically lumped in with 3 other priorities under bilateral agreements that are still to be negotiated. There's no defined funding. Considering you say you have a focus on mental health, considering you promised a permanent mental health transfer in 2021, why this approach, and is the mental health transfer still in the works?
5 years ago, in 2017, we signed historic deals with the provinces, including investments in mental health over the coming 10 years. One of the things that we heard from stakeholders, from community members, from people having trouble accessing mental health care across the country, was there needed to be more clarity around outcomes. There needed to be more transparency, more data collected around what services were being offered. So as we move forward with historic investments now with the provinces, we're also ensuring that there is a clarity and a transparency, including around mental health, which is one of the 4 pillars around which these bilateral deals will be created with the provinces. But on mental health, I'm not the best person to speak to it because we have an extraordinary expert with us here today. I'd love to invite Carolyn Bennett, our Minister of Mental Health and Addictions, to say a few words about how much mental health and our approach on mental health matters to Canadians.
Thank you, Prime Minister. I think it's been for 20, 30 years that I've been fighting for transformation in healthcare. But we actually need to build a system around everybody having a family doctor, which allows people to, and what these priorities are articulating is that if everyone has a attachment to a family health team with additional mental health and supports, that is their way of approaching the whole of the health system, and that is built into how we see the dollars for primary care and primary care reform. In the support for health workers, we know that mental health has to be part of healthcare workers' support such that they don't burn out and such that they've got the supports to be able to stay in their jobs. When it comes to mental health and substance use, we are going to make sure that we are measuring the kinds of wait times to community-based services and substance use services, but also be able to use the Canada Health Survey to say what are the unmet needs in mental health across the country. And then in terms of the data, as the Prime Minister said, we need that transparency and accountability and the ability to be able to share information in a secure and confidential way. We need to be able to know what we're doing and to be able to leave no one behind. I'm very excited about this approach which integrates mental health into everything we do, as the Prime Minister said, as says in the 2nd paragraph of the Canada Health Act. That's what we have to be able to do, to get mental health back in to our publicly funded system, and for us to leave no one behind and be able to make sure that mental health is health.
Next question.
Hi, Prime Minister. Toria Isri, Global News. Just to be absolutely clear on your answer, I'm going to repeat my colleague's question. Is this your final offer to the provinces? Is there wiggle room?
There are negotiations about to start with the provinces on how they want to make sure that they're hitting those 4 priority areas we're facing. We put forward the fiscal frame that the federal government has and the investments that we're putting on the table for provinces to do. Now, provinces have the flexibility of putting more money into primary health care, putting more money of this into mental health, or more support for workers, or doing a lot more on data. But they have the flexibility to meet within this envelope their priorities so that Canadians all across the country get the best care. This is the offer we put forward on the table. This is the billions of dollars that are there for provinces, and we certainly look forward to working with them to be able to deliver not just that money, but those healthcare improvements to citizens across the country.
The premiers have expressed disappointment though, so how realistic is it that money will start flowing in the next budget, given their dissatisfaction?
I know for a fact that a number of the premiers are looking at these billions of dollars that we're willing to put on the table to invest in improvements in healthcare systems, and we'll be moving quickly on this. Canadians know that we do best as a country when different orders of government roll up our sleeves and work together to deliver the right results for Canadians. Canadians need access to family doctors. Canadians need better and quicker mental health services, particularly for young people or people struggling with addictions and substance abuse issues. People need to see support for our frontline health workers who've been such heroes through the past difficult years, and people need to know that we need to have a system, a modern system, grounded in science, in data, in information, to make sure people get the best possible care exactly as they need it. There are billions of dollars that we're putting forward in new money for the provinces. We're just looking forward to working with them and delivering it.
Next question.
Hi, Prime Minister Rafi Jukanian, CBC News. You're talking about governments working together. Doug Ford called this a down payment. It doesn't sound like you're on the same page at all. Is there any further room for negotiations with amounts and terms in this deal?
$198 billion in additional funds over the next 10 years. This is a massive investment in not just the present of healthcare, but the future of healthcare in this country. And it's something that is going to make a real difference. We know there are going to be increasing pressures in our healthcare system, but we also know that grounding it in access to primary care, proper support throughout the system for mental health care, proper support for our frontline workers, for health professionals who've been working too hard, and all of it grounded in facts and data and information that ensures the best possible system. That's how to build a stronger healthcare system, not just for today, but for tomorrow. That's what we're excited about.
And you didn't raise the issue of private delivery in this meeting, again, according to Premier Ford. Are you not concerned about this? Why didn't you talk about it? Any conditions at all?
Don't mean to contradict anyone, but the very first thing I brought up in the meeting was the fact that defending the Canada Health Act, upholding the Canada Health Act, the principles within, is an absolute non-negotiable priority of this government. We're a government that a number of times over the past years has clawed back money from provinces who were not abiding by the principles of the Canada Health Act. We won't hesitate to do that again. The fact is, we are going to ensure that Canada's public universal healthcare system continues to deliver the best possible care to Canadians. It's going to take not just investments, it's going to take a strong framework, and that's exactly what we're sitting down to build with the provinces now. Une des premières choses que j'ai soulignées dans ma rencontre avec les premiers ministres, c'est l'importance de respecter la loi canadienne sur la santé. Les Canadiens comprennent que notre système public universel est une richesse incalculable pour notre pays. La capacité d'avoir les services de santé de qualité nécessaires sans être préoccupé par le besoin d'hypothéquer sa maison ou de s'endetter pour une chirurgie. C'est une fierté pour les Canadiens. Nous allons toujours défendre la loi canadienne sur la santé. Nous allons toujours nous assurer qu'elle soit respectée.
Dernière question.
Oui, Marco Gallas-Serino du Devoir, bonsoir. Avec 48 milliards de dollars supplémentaires en 10 ans, est-ce que les provinces vont avoir la capacité financière de régler tous les problèmes du système de santé?
Le gouvernement fédéral n'a pas la responsabilité de livrer les services de santé. On reconnaît que c'est les champs de compétences et c'est l'expertise des provinces. Et donc, nous allons nous asseoir avec eux pour travailler, pour s'assurer que, en matière de médecins de famille, en matière de soins de santé mentale, en matière d'appui pour les travailleurs, en matière d'information et de données, ils fixent les cibles appropriées qui vont pouvoir améliorer de façon profonde et réelle les services de soins de santé offerts aux Canadiens. Nous savons que ces 4 éléments sont à la base d'un système qui fonctionne. Et nous savons que les 198 milliards de dollars en fonds additionnels pour les 10 prochaines années, dont, comme vous avez dit, 48 milliards entièrement nouveaux, vont aider énormément à livrer ces services.
Concernant les accords bilatéraux dont vous avez fait allusion, M. Legault, Premier ministre du Québec, a dit que la bonne nouvelle, c'est qu'il n'y a pas de conditions. Donc, M. Trudeau a été très clair avec moi. Si on souhaite investir 100% de l'argent dans une de nos priorités, on peut le faire. Même si on nous demande de partager les données, il n'y a aucune condition d'atteindre des résultats. Notre seule imputabilité, c'est face à nos citoyens. Est-ce que M. Legault a bien compris?
Ultimement, on a besoin d'un système qui fonctionne pour les citoyens. C'est les Canadiens, les Québécois qui vont juger de leur système de santé. En mettant de l'avant un système axé sur les résultats et les données, les Canadiens vont plus avoir à réfléchir « Ah, mais il a investi 10 millions de dollars ici ou 100 millions de dollars là ou 1 milliard ici », ce qui veut moins dire que « Ah, j'ai pu trouver un médecin de famille pour ma cousine. J'ai pu obtenir de l'aide pour cette crise de santé mentale que mon fils est en train de vivre. On a pu trouver un spécialiste pour ma grand-mère. » C'est ça les résultats qui préoccupent les Canadiens. Ce à quoi les Canadiens veulent, c'est qu'on travaille ensemble pour les livrer. Et ça, les accords qu'on est en train de bâtir avec les provinces sont ancrés dans ces résultats concrets pour les Canadiens, avec les données, avec les éléments qu'on va mesurer de façon ouverte et transparente. Ultimement, nous sommes tous redevables aux citoyens en tant que politiciens, et c'est à eux qu'on doit le meilleur système de santé possible. C'est exactement ce qu'on travaille pour livrer maintenant.
Merci beaucoup, c'est ce qui m'a fait la conférence de presse de ce soir.
Merci beaucoup tout le monde.